Welcome back, our dear viewers. Now we'll go to the main topic of the day. It will be World Sight Day 2016, and our distinguished guest, Dr. Ohoud Abdulaziz Owiadhah, who is consultant ophthalmologist from King Khalid Eye Specialist Hospital, Riyadh, and she is a member of Board of Directors and Chief of Public Awareness Committee in Saudi Ophthalmological Society. Welcome, Doctora.
Thank you very much, Dr. Mohammed. First, I'd like to thank you for inviting me to your excellent program. I'm so pleased to be here with you and your respectful audiences.
Actually, it is a great honor and pleasure for us being with us. Without further delay, we'll start by what's the purpose of the Awareness Day you conducted?
Well, the World Sight Day is an annual international awareness day, and it's held every year, always on the second Thursday of October. This is every year. And the main purpose or the target or the idea of the World Sight Day is to focus the attention of the public on the importance of the blindness and the visual impairment, what are the most common eye diseases, how to prevent them and how to deal with them if they are there. This day is organized by the International Agency of Prevention of Blindness, and here in Saudi Arabia, the organizing area is the National Committee of Prevention of Blindness with the leadership of His Royal Highness Prince Abdulaziz bin Ahmed bin Abdulaziz Al Saud, and the Secretary General Professor Mubarak Al Faran, and I was honored to be the co-chair of the organizing committee for that event.
Excellent indeed. It's great work. So what is the theme of 2016 World Sight Day?
Actually, each year the International Agency of Prevention of Blindness, they put a specific theme which focus on a certain disease or certain type of eye diseases. This year the theme was Stronger Together, which actually gave a more broad idea, and it gave us more generality, so we could focus on most of the common eye diseases, and we could focus on the prevention rather than going into the very severe stages of the disease.
Excellent. So you focus in this day about prevention more than
it's
cure.
More of prevention. It's more of interaction with the public. We need to share our knowledge with the public about the common eye diseases. We need to chat with the people. We need them to know what are the common eye diseases, how to prevent and how to deal with them, and what's the ideal time for people or a person to go to an eye doctor.
Excellent. So this is an annual event and organized for the second or third or?
It's annual event on the second Thursday.
How many events you have organized consecutively?
It's every year. This is annual event. Yeah.
Excellent.
Yeah.
Is there anything new this year to your event that distinguish it from last year?
Actually, this year we have, I can say, the highest number of the activities all over through the kingdom. We have, and we are still having and waiting for almost 25 activities or events through the kingdom. Those activities are either medical, which are held in the hospitals, like university hospitals or the eye specialist hospitals or the governmental hospitals, private sector as well, or also some social activities which are usually held in the shopping malls, schools and so on. We're also waiting for an event in Granada Mall this Thursday in Riyadh, inshallah. So I'm encouraging everybody, to go and share with us.
Do you have any entertainment, artistic shows, or anything that attract the audience? Because actually this year we tried to focus on the entertainment more
hard and the rough or the solid part of the event. We had a photographer who is blind, and he could do a great photos for the audiences, and they enjoyed that. And he's supposed to be with us in Grenada, inshallah. Also, we make like an experience for the people. We covered their eyes and we asked them to draw and write something without seeing, just to experience the feeling of blindness or decreased vision. A lot of other activities, a lot of
very interesting.
Yeah, scientific activities, of course, are held in all the hospitals almost.
Excellent. So we will go for a short report about health, about myth and fact. We'll talk about antiperspirant causes breast cancer, and being cold gives you a cold. Please stay with us. And now back to our guest, Dr. Owiadhah. Just I would like you to shed some light about the anatomy of the eye, because I think the eye is the most important organ to enjoy life, but not to survive.
Exactly.
So can you just, about this small organ, tell us how complex, okay?
Yeah, it is small, but it is everything, I can say. For simplicity, just for the public, the eye contains two major components. The external part, which is the eyelids, the eyelashes, and the eyebrows, of course, and the internal part, which we call it the globe or the eyeball. The eyeball itself also has so many components, starting from the first part, which is the transparent part, which we call it the cornea. It's the part that has the most refractive error or the most refractive power in the eye, and through this part we can see, or we should see, clearly. Next to the cornea is the iris, which is the colored part in the eye, and then the lens, which also has a very important refractive power, and then inside the eye we have the retina and the optic nerve. This is just for the simplicity for the public. Excellent. Of course, each part has its importance and its functions, and we need all those parts to be clear and functioning well in order to see everything in a clear way.
Very interesting. How common eye diseases in Saudi Arabia and worldwide? Do you have any local statistics, or only we rely on the international numbers?
According to the last updated study, which was published in 2010, the number of visually impaired people worldwide is almost 283 million.
183 million.
Yeah,
okay.
yeah. That was actually 6 years ago. It was in 2010. So I believe this number has increased dramatically now. So it might reach up to 300 million.
Sure.
And almost 40 million of those people are legally blind, or what we call totally blind. So they cannot see even the light. And unfortunately, here in Saudi Arabia and the Gulf region, and I can say also the Middle East, we constitutes almost 12.5% of that number. So you can imagine how many people we have who are complaining of visual impairment.
12.8%.
12.5%, yeah. So this is a really very high number, very significant, and that's why we are here. That's why we are launching and organizing those such awareness days. We need the people to be aware of those problems, to be aware of this high number, and to know what are those common eye diseases that they can prevent before they happen.
Before we go to the most common diseases, but what do you think the reason for this high percentage, 12.5%? Is there any explanation or theories about that?
Part of this is due to the inheritance factor, or the genetic factor, which is highly occurring here in Saudi Arabia. The other part, I would say it's due maybe to some systemic diseases like the diabetes, which is almost like an epidemic disease here in Saudi Arabia. We have a lot of problems related to the diabetes and occurs in the eye. A lot of complications due to uncontrolled diabetes that occur in the eye, and unfortunately it leads to loss of vision.
Excellent. So inheritance, you mean it is marriage between relatives, that's why we have
exactly the consanguinity between, yeah.
Excellent. So this is leading us to the next question. What are the most common eye disorders or diseases?
Well, the eye diseases are many and different, and they differ according to the demography or the geographical distribution. So what we can see here in our area, maybe you cannot see in other area, and vice versa. But in general, I would say that the most common international eye diseases are the cataract, which is cloudness of the lens and of the eye. And this usually occurs due to the aging process. It comes with age, actually. Or sometimes it comes due to some systemic diseases like diabetes or hypertension, or due to inflammation in the eye or trauma, or taking some medication like the corticosteroids. The other most common eye disease also is the refractive errors, like the nearsightedness or the myopia, the farsightedness or the hyperopia, the astigmatism. All those are very common, and they are simply treated by the glasses, using of eyeglasses or the contact lens, or some people, they like to go and do a refractive surgery for that. We have also here in the area the glaucoma, which is an optic neuropathy, or it's a disorder of the optic nerve, which is usually due to increase in the intraocular pressure of the eye. And we have it here in very high number, again because of the consanguinity and because of the hereditary factor. Also one of the most common is the diabetic retinopathy, or the effect of diabetes mellitus, in particular the uncontrolled diabetes mellitus on the retina. And those complications that can lead sometimes to retinal detachment, hemorrhage in the eye, those complications sometimes are hard and difficult to be treated.
Okay, thank you, Doctor. Now we'll go to a brief report about World Sight Day 2016. Please stay with us.
I am Professor Mubarak Al-Farhan, the Secretary General of the National Committee of Prevention of Blindness, and also the General Secretary of Saudi Ophthalmological Society. This is the International Day of of Prevention of Blindness. It's a yearly event which we actually gather and promote the public education about the common ocular diseases in the region.
Here is with us Mohammed bin Saad. Mohammed is blind. May Allah bless him. Totally blind. And what can you tell me, Mohammed? This is a very special day for a site.
I have a message. I mean, many messages that I would like to send to the whole world. I'd like to tell them that blinds, we just live just like others. We have our dreams, our goals, and I think what I'm going to do here, what I did already, is just to tell the whole world that we are just like you exactly. So, for example, I can take pictures normally using the echolocation, some technique called echolocation or sound direction. It's very important for me because most of people think that blinds cannot do anything, they are not independent, and this thing is very, very, very mistaken and very wrong idea about blinds. So I'm here just to tell them that we're here, and we are just like you exactly, but use different techniques, different technologies. I'm very happy here. All of them, or most of them, think that blind very sad. No, I'm very thankful, and I don't want my sight to get back. I'm very happy. I have more than 70% for my sight to come back, to get back, but I didn't go through it. I want to stay blind. I'm very happy.
May Allah bless you. Any message or any thing you would like to say in the last, Mohammed?
Media is not everything. Just try to look around you, because some media just protect blinds as, you know, I'm not about to say what I'm thinking about, but just look around you, because blinds are there. They're using technologies just like you exactly. Their eyes are blind, but their minds are sighted. So I'm very happy, and I hope they can receive my message perfectly, clearly.
Thank you so much for your time, Mohammed.
Thank you very much. Thanks to you. Bye-bye.
And now back to our guest, Dr. Ohoud. Actually, this report was inspiring and heart-touching. Just to proceed to our interview, what are the symptoms of eye diseases that present red flags or warning signs that we ask patients to seek medical attention immediately? Okay.
Actually, the eye, as I mentioned before, is a very precious organ, and it's very delicate, very sensitive. So whenever any person experienced any abnormal or bizarre symptoms, he should go immediately and seek the medical attention for that. In my opinion, not even a single symptom should be ignored, but there are, like you mentioned, red flags in the eye that we should go immediately and ask for a consultation, like sudden loss of vision, or seeing like hollows around the light, or seeing like flashes of the camera, having very painful eye or ocular pain, headache sometimes, having abnormal redness in the eye, abnormal discharge. This would immediately, raise like an alarm that the person should go and seek medical attention.
Just a question: is it a myth or fact that reading the mobile or cell phone overnight can damage vision or decrease or cause deterioration in the vision? I would like to hear from you about this.
I cannot say it's a true or it's a myth, but again, reading has like a criteria, or we should have like a perfect or standard environment for the reading, especially when using those smartphones or the tablets and so on. Staying a long time on those devices would make the person exposed more and more prone to the dryness, because he forgot to blink because of too much concentration on the device. So this will cause dryness, this will cause headache sometimes, this will cause eye pain, eye strain, and those are the symptoms that every person should be alert with that. Going into blind, I think this is something not logic. No, yeah, not logic, yeah.
Yeah, okay, good. What causes eyes to water? Okay, is there any cause about this?
Watery eye can be caused from either the very, very benign and simple symptoms like the dryness. You know, we're here in Saudi Arabia, we're living in a very hot country, even the south and north with the very cold weather. Also, most of the people also there, they have dryness. The infections, the inflammations, sometimes they can cause this watery eye. But sometimes also if there is any problem or a disorder of the nasolacrimal system, which is the system responsible for producing and evacuating and secreting the tears inside the eye. So any disturbance or any problem with that system can also cause tearing.
Yeah, related to the same question, how we comfort how we comfort itchy and sore eyes? Is there any methods recommended?
Yeah.
Okay.
Again, it depends on the cause. If it is, as I said, it's like just simple dryness, so using lubricant eye drops would help much in this. But if it is due to infection or inflammation or any other cause, then the person should go to the medical doctor or an eye doctor and see what's the cause, and the cause should be treated accordingly. But in general, I would say, and I would advise everyone to have his own lubricant drops beside, and to be handy to use it anytime. This will help a lot in this situation.
So it doesn't have any side effects on the long run, or they're absolutely safe, the lubricants?
Actually, the lubricants in general, they are safe, especially if they don't have preservatives. So we always advise to use the preservative-free lubricants. But again, those drops also have, if they get infected, for example, they would have also their problems. But again, if they are kept in a very good, healthy, clean environment, they are very helpful for those patients with dryness.
Excellent.
Yeah.
What are the causes of sudden blurred vision or sudden loss of vision? Okay.
Yeah. Sudden loss of vision means something, critical or serious. Yeah, it can be either something inside the eye or it can be in the brain. So we should be very alert when the patient have a sudden loss of vision, even if it is temporary, which we call it transient or transient ischemic attacks. Those should give an alarm to the person that there is something serious happening. So starting from the infarctions inside the eye, inside the blood vessels of the eye, or even sometimes problems in the optic nerve or problems in the brain itself. So any sudden loss of vision is really serious and critical, and the patient should go immediately to seek medical attention. Yes.
Okay, good, excellent. What are the ophthalmological symptoms and signs of a systemic disease? So we know the eye is linked or related to the many systemic diseases. Can you tell us about some of the examples?
Most of the systemic diseases, they have symptoms or signs which are reflected on the eye, because we usually say that the eye is the mirror of the body. So through the eye we see the other parts or the other organs or the other systems in the body. The most common symptoms or signs which are associated with systemic disease are the dryness. Dryness is number one, especially on those patients who have immunity problems or immune reaction problems in the disease.
Also, like Sjogren disease.
Exactly, yeah. Those autoimmune diseases, most of the patients, they are presented with very bad dryness to our clinic. The other issue is having cataract or a progression of cataract. This is also seen most in people, in persons or people who are having systemic diseases. Yeah.
What about red eyes? Red eyes sometimes just cause due to allergic reaction, or sometimes can reflect systemic disease?
Red eye can be benign and can be something serious. So if it is like an infection or simple inflammation, it can give red eye. Or sometimes it is a sort of allergy or dryness can also give red eye. But if you have, for example, tumors, or you have sudden attack of high pressure in the eye, which we call it the acute glaucoma, this also would give a red eye. And again, this is an alarming sign for the patient.
Mm-hmm.
Yeah.
Because usually as ophthalmologists, do you take history or only focus on the eye, or you ask about other, system organs?
History is very critical in our job. History is number one. We dig in the history because with the history, since how long the patient had his problem, how was it? Is it acute? Is it like chronic? Is he having any other problems? Is he taking any specific medications that could lead to this problem? So history is number one, like any other specialties. And then we go and examine the patient with a full examination, and then followed by some investigations, which is different according to the subspecialty. So in glaucoma, we have certain investigations which differs than the retina department, or for example, the oculoplasty or the strabismus.
Mm. Yeah, because we say that if the only tool you have is a hammer, you tend to treat every problem as a nail.
Yes.
So just you look at the eye and you overlook the rest of the body. So that's not true, okay?
No.
Okay, great. So since you mentioned that diabetes mellitus, one of the most common causes of eye diseases in Saudi Arabia. So any diabetic patient should be seen by ophthalmologist, and what's the since start of diabetes, or after 5 years, type 1, type 2? Can you just enlighten me?
Well, actually it depends, as you mentioned, Dr. Mohammed, on the type.
Excellent.
So if it is type 1 or type 2. But in general, I would advise every diabetic patient to have at least initial eye examination, especially dilated fundoscopy with the retina specialist, initially when he's diagnosed with diabetes.
At diagnosis?
At the diagnosis,
This
yes.
is for type 2 diabetes?
Yes.
Or for adult, okay?
For the adults, exactly. Usually for the young people, we need to have like every 5 years, but again, this depends on the severity and the stage of the diabetes. But my advice is to have a first initial examination for every diabetic patient, and then the retina specialist would say and would tell how frequent would be the visits for that patient.
Okay, so it will be decided based on the severity of the disease, how frequent they will be evaluated.
Exactly. Mainly on the symptoms and signs which are seen inside the retina. The diabetes affects the eye in so many ways, starting from the dryness, the cataract, ending with the most severe, which is the diabetic retinopathy. So diabetic retinopathy is the main concern for us as ophthalmologists. The retina specialist, when he do his fundus examination or dilated fundoscopy, he would stage which stage of the disease for that patient. So either he would need just regular observation and follow-up, or the patient might need laser inside the retina, or sometimes if the patient presented in a very late stage, he would need surgery sometimes.
Excellent. So you have early stage and advanced stage. Okay?
Exactly, yes.
So it depends.
Yeah.
So now we'll go for Award Side Day Report 2016. Please stay with us.
Here is with me Dr. Mahmoud Abdul Jabbar Yamani. Welcome with us, Doctor. What can you tell me about this special day?
The World Sight Day is a very special day that we use as a window to inform the public about eye problems and sight diseases, to prevent sight problems, to detect early problems before they become very progressive and detrimental. It is again, as I said, a station for international organizations and international hospitals like King Khalid Eye Specialist Hospital to participate in the community by preventing disease, by detecting early disease, and by also including and engaging people that lost sight into the community. It's an educational activity that the organization does with international and local organizations who are concerned with vision and sight. And it is one of the landmarks for King Khalid Eye Specialist Hospital that we're very keen on doing. And we don't only stop on these days, but we function between days in the entire year to make sure that we fulfill our role as a corporate in the corporate social responsibility, in education, in training, in engaging the community into the disease processes, knowledge and attitude towards disease. And that is only a small part of what we do year-round.
Welcome back, Dr. Ohoud. Okay, so we'll come to the next question. Which eye diseases can cause permanent loss of vision or irreversible? Okay.
Yeah. I can classify this into the preventable causes and the non-preventable causes. The preventable causes like those like the diabetic retinopathy, the cataract and the glaucoma. Those diseases, if have been detected early and treated early, then you can avoid the permanent loss of vision. On the other hand, we have the non-preventable eye diseases, which causes permanent loss of vision, like the hereditary retinal diseases, for example, like the retinitis pigmentosa, the red cone dystrophy. All those diseases, we are still hoping and waiting for in future to have more solutions for those diseases in case of, in care of the patients who are having those diseases. Yeah, so those mainly the most common eye diseases that cause a permanent loss of vision.
Excellent. Is hypertension as severe as diabetes to the eye, or?
The hypertension also reflects its severity on the eye and sort of having abnormal blood vessels, and we call it vasculitis. But again, it's not as serious and important and common as the diabetes and diabetic retinopathy in our country.
But if you have the combination of diabetes and hypertension, is it more damaging or devastating?
Yes,
or?
of course, yeah. But I would say that always the diabetes has the higher hand. The complications and the side effects and the problems from diabetes, those are the scary, I would say, symptoms and the scary events and sequelae of the diabetic retinopathy.
Okay, we always hear in the past that trachoma, caused opacified eye or white eye in the past. Is it still existing, this disease, or eradicated?
Thank God it has been eradicated. We are not seeing an active or acute trachoma anymore. What we see, and it is very rare actually nowadays, is the sequelae of trachoma or the chronic trachoma. I mean, those old people, old generation who had been infected with trachoma in the past, and they have only the chronic picture or the chronic signs of trachoma there.
What are the chronic signs? Because that's still we have many people, okay?
Mainly dryness and some deposits inside the upper eyelid and the lower eyelid sometimes, some opacity around the cornea, blurring of vision, feeling like a foreign body sensation. Those are the most common signs.
Excellent. Yeah. And in case of a trauma to the eye, direct trauma of the eye, what are the scary signs or worrisome symptoms if we have trauma to the eye?
Trauma could be penetrating and non-penetrating. We call it blunt or like a stab wound or penetrating trauma in the eye. Both are serious, and both should seek medical attention. Any organ or any part in the eye could be damaged and affected with the trauma, starting from the cornea, which is the upper part, going up to the lens, the iris, the vitreous, and the retina, and the optic nerve. So any case of trauma, even if it is very mild trauma, I would advise to go and have like a full examination or a simple eye examination, just to make sure that everything in place, nothing has been occurred, because sometimes some eye diseases or problems of the trauma, they don't show any symptoms. So it's very important that a person who had trauma to go and have at least one full ocular examination. Yeah.
You know, common in the pediatric population that we have corneal abrasion. Can you just tell us about how what should we do when we have, you know, corneal abrasion in the child?
Yeah, corneal abrasion, again, it should be seen and diagnosed by the ophthalmologist, because it's not a matter of like having like wound or superficial wound. Corneal abrasion means that you have a damage to the anterior surface of the eye, which is the cornea, and again we need to make sure that there is no foreign body there, so there is no also extra damage to the eye. Each corneal abrasion should be seen and diagnosed and treated by the ophthalmologist. In case if it is like just simple or superficial abrasion and it was diagnosed by the ophthalmologist, then usually patching the eye for 24 hours or 48 hours will be enough, in addition to using the antibiotic eye drops.
Excellent. What's the, rationale or objective of patching of the eye? Why we patch the eye in case of
patching? It gives a time for healing of the superficial layer of the cornea, which is the epithelium, because with the trauma, this part or this layer has been sludged out. So patching gives time to heal out and speed up the healing in a clean environment, because we put the eye drops or we put the treatment and we cover the eye. So that's why we allow or stimulate clean healing of the epithelium.
Excellent. Because in medicine or internal medicine, we have our patient, they take or ingest multiple medications. What are the medications that can harm the eye or cause, damage to the eye?
Yeah, mainly the corticosteroids. We always ask about that in our history. Corticosteroids can cause a lot of signs in the eye, starting from the cataract or the cloudness of the eye lens, ending with increase in the intraocular pressure, which we call it glaucoma. And glaucoma sometimes has no symptoms. So each patient in our clinic, we should ask for the use of the corticosteroids. Of course, there are other certain medications like the antidepressants, and those medications can affect the circulation of the aqueous or the fluid inside the eye, and those we just ask specifically if we have glaucoma patient, for example.
Excellent. Because how we prevent, so patient on steroids, how we prevent is there any way to prevent complications, or the damage will eventually happen?
That's why with each patient who should or supposed to be on steroid, he should have an ocular examination. Baseline examination, exactly. We need to check his pressure, we need to see his lens, we need to do full ocular examination. If everything is in place and he's having no symptoms or no signs, then just like regular follow-up every 6 months or every year, according to the dose and how frequent he should be on the steroid. In case if he showed any symptoms or signs, then we need to discuss this with his treating physician, either to replace the steroid or to decrease the dose, or to shift to something different.
Excellent. Because you know that we are using, or rheumatologists using chloroquine or plaquenil. It's like the aspirin of the rheumatologist.
Exactly.
Does it damage the eye? Does it cause any problems? Plaquenil?
Sometimes it has some effects on the retina. So again, those patients should be investigated thoroughly, and we know what exactly their medications. And usually those patients, they are guests in our clinic, the rheumatologist patients. We see them a lot in our clinic because of the dryness and the other associated symptoms in the eye. Yes, this medication causes sometimes a retinal problem, but it's not that common as like the effect of corticosteroids on the eye. Yeah.
That's why we have to have baseline examination.
Exactly.
Before starting this medication.
Yes, this is the ideal. This is the standard that we like to apply here. Yes.
Excellent.
Yeah.
With that, Dr. Ohoud, we come to conclusion. Dr. Ohoud Abdulaziz Owiadhah, consultant ophthalmologist from King Khalid Eye Specialist Hospital. It was a great pleasure and honor with us. Thank you very much. Okay.
Thank you. Pleasure was mine.
Okay. Now we'll go to our last segment, which is health benefit. Please stay with us. Welcome back. Just to conclude, I will say eye is the most precious organ and it's the mirror of the body. Please take care of it. With that, Assalamu alaikum wa rahmatullahi wa barakatuh. Goodbye.